Going back to our top story, health officials logged the country's first two cases of the COVID-19 variant first found in India. Now, that variant is among the factors that contributed to the brutal second coronavirus wave crippling India. Hospitals in the South Asian nation are overwhelmed and running out of medical supplies. Is our government prepared for the possible spread of the variant? We now go above and beyond the headlines with treatment czar Leopoldo Vega. Undersecretary Vega, thank you very much for joining us this evening. It's good to see or, well, hear you again. The arrivals of these two India variant cases, sir, April 10 and April 19. However, we declared a ban, a travel ban on India on April 27 to take effect April 29. Would you say this was a missed opportunity, sir? April 10 ang dating, tapos 2.5 weeks later yung travel ban?
Yeah, right, Pia. Good afternoon, and good afternoon to CNN. Definitely, this was kind of late in terms of the implementation of the travel ban, but it's also good to point out and very significant that two of these returning Filipinos who came from actually the Middle East were properly quarantined by the Bureau of Quarantine. And they have recovered, and they have been, I think, negative on the PCR test on the 14th day. So in other words, there was a good policy in terms of the quarantine, and the protocols were set in terms of returning Filipinos coming from India or even in the Middle East.
Mm-hmm. So for these two cases, sir, dapat ang magiging concern na lang po natin ay yung mga nakasalamuhan nila, mga nakatabi nila sa eroplano halimbawa. Or in a ship if they had taken a ship.
Yeah, they were in the plane, and I think the epidemiology or the RESU or the Regional Epidemiological Unit are actually doing the contact tracing of all the within the area of the plane or where they were seated.
Okay, pero their arrivals were April 10 and 19. It is now May 11. So, na-trace na po lahat ng mga close contacts nila?
Yes. I definitely they have to trace the close contacts and those close contacts inside the plane.
Okay. Well, I some people might be thinking, why are we talking about testing and tracing? But you are the treatment czar. But of course, ang ayaw lang kasi natin ay kailangan dumating pa dun sa kailangan mag-treatment tayo. Kaya what we're trying to do here, sir, hindi po ba, no, is preventive measures. No? That's why we're talking about testing and tracing. But also, sir, now that we have these two cases, and what we fear and what we hope will not happen is that it spreads even further in this country. How will this the presence of these variants shape or reshape our pandemic response?
Definitely, if there are no border controls and the variants of concerns will actually creep in the national capital region or in the other region in the Philippines, these variants have been known to be highly transmissible, and they say that they are also more virulent compared with the other variants. So if we are not able to control or the borders in terms of people coming in from other countries with variants of concern, that definitely will impact on our health capacity system.
So would you recommend, sir, an extension of this travel ban on India and neighboring countries?
I think what should be done is, even for the neighboring countries, there must be a very standard protocol when they come in and when they are tested, and they should be quarantined at least for 14 days, irrespective of the results of the PCR on the 7th day. They must complete the 14th day so they can be cleared from any kind of disease.
Mm-hmm. Sir, vaccination will be ramping up by the third quarter thanks to COVAX and the private sector and government also, because there are some that are coming in purchased by the government. But now there are concerns about efficacy against these new variants. What can we do about this, or should we just focus on getting as many vaccinated as fast as possible and hope for the best?
Yeah, right. I think there are reports that these variants of concern might actually evade the antibodies formed by the vaccines. But the best effort right now is that we must vaccinate all, or we must come up with a good number of vaccinated people, so that it's a way really of suppressing the spread of the infection. If there are more people who are not vaccinated, I'm pretty sure that the variants of concern can easily be attained. So what we are trying to do here is make sure that we can ramp up the vaccination so that we can actually suppress the spread of or mutation of the virus.
Undersecretary Leopoldo Vega, sir, thank you very much for joining us this evening. Salamat po, sir.